I'm in a bit of a unique position because I typically see women who have not been diagnosed with cancer, and what I hope to do is keep them that way. But a lot of women are still really nervous. They're coming in because they're worried that they have a higher than average breast cancer risk. They come in with a couple different concerns, whether that's, again, just fear of developing cancer or fear of some of the options that, we might suggest for them. Usually when I meet a woman for the first time, we're there just to have a conversation. We're there to figure out, okay, does she have a higher than average breast cancer risk? And if so, how high is that risk? We then talk about her options. A lot of women are afraid when they come in, they're going to be told that they need a double mastectomy, and that's not at all the case. Women have a lot of options, whether that's just making healthy lifestyle choices, taking medication to reduce their risk. Some women do opt for surgery. We offer increased screening. But bottom line is women have a lot of options, and their input is really important for figuring out what the best plan of action is. One of the biggest things about Siteman, one thing that really makes us unique, is that we all have very specific areas of expertise. So all I do is take care of women who are higher than average risk for breast cancer. So I'm able to stay on top of all of the different, new guidelines, new recommendations. And then we offer clinical trials, of course, for women who are ultimately diagnosed with cancer. They have a lot of clinical trial options. We also actually have clinical trials looking at figuring out the genetics of cancer. So women can have their genetic testing matched with databases looking at their overall health history. So again, participating in a clinical trial like that is something that they can do at Siteman that they probably can't do somewhere else. What I really want women to know is that they have options, that there's nothing that they're going to be told that they have to do or that they should do. It's always a conversation to figure out what is best for that individual patient. The other thing that I think is really helpful for people to know is, especially when we're looking at hereditary cancer risk or genetic cancer risk, I'm taking care of the woman in front of me who might have a cancer gene like a BRCA gene, but that came from someone in her family. And so typically there are all of these other family members who might also be at risk. So ideally, we can identify these genes in women and sometimes in men before they develop cancer. So we can then again take appropriate screening actions, screening them with different modalities, screening them at a younger age, or even take steps to reduce their cancer risk altogether. In general, I take care of women for a long period of time. Often I'll take care of multiple women within the same family because there's some genetic cancer risk. And so that, I think, is the most rewarding thing, is being able to develop those long-term relationships with women.